Did you know that diabetes is one of the leading causes of blindness worldwide? What's even scarier? Most people don't even realize their eyes are in danger until it's too late. The culprit? Diabetic retinopathy inflammation. It silently damages your retina, causing swelling, bleeding, and even permanent vision loss. But here's the good news. You can prevent it if you act fast. Stay with me as we uncover the shocking truth about diabetic retinopathy inflammation, its deadly progression, and the best ways to protect your eyesight. Make sure to watch till the end, because we'll reveal a powerful eye-saving strategy that can slow down the damage. Section 1. What is diabetic retinopathy inflammation? A hidden danger inside your eyes. Diabetic retinopathy inflammation is a serious eye condition that develops when high blood sugar levels trigger chronic inflammation in the retina, the part of the eye responsible for vision. Over time, this inflammation weakens, blocks, and damages tiny blood vessels, leading to vision loss and even blindness if not treated. But how exactly does this happen? Let's break it down. What happens inside the eye? The retina is a delicate, light-sensitive layer at the back of your eye that needs a constant supply of oxygen and nutrients. It receives these from tiny blood vessels called capillaries. But when blood sugar levels remain high for too long, inflammation begins to develop. Here's what happens next. Blood vessel walls weaken. High sugar levels make retinal blood vessels fragile and prone to leaks. Fluid leaks into the retina, edema. As inflammation worsens, fluid and proteins start leaking into the retina, causing swelling, macular edema. That blurs vision. Blood vessels get blocked. Chronic inflammation narrows and clogs capillaries, reducing blood flow and oxygen to the retina. The eye tries to fix itself. In response, the body creates new blood vessels, neovascularization, but these are weak, fragile, and prone to rupturing, leading to bleeding inside the eye. Scar tissue forms. As damage progresses, scar tissue develops on the retina, pulling it away from the eye and increasing the risk of retinal detachment and permanent blindness. The role of chronic inflammation is your body's natural defense mechanism, but in diabetic retinopathy, it becomes a major enemy. When blood sugar levels are too high, the body releases inflammatory chemicals called cytokines and vascular endothelial growth factor, VEGF. These increase oxidative stress, leading to cell death in the retina, cause blood vessels to become even weaker, leading to microaneurysms and hemorrhages, worsen swelling in the macula, making vision blurry, speed up disease progression, leading to advanced stages of diabetic retinopathy much faster. Fact: research shows that diabetics with higher levels of inflammation experience faster and more severe vision loss compared to those with better inflammation control. Why this condition is so dangerous. One of the scariest things about diabetic retinopathy inflammation is that it often has no symptoms in the early stages. Many people don't even realize they have it until serious damage has already occurred. By the time symptoms appear, such as blurry vision or dark spots, permanent retinal damage may already be happening. That's why diabetics need regular eye checkups. Early detection is the key to saving your vision. Did you know? Over 90% of diabetics will develop some form of diabetic retinopathy over time. Inflammation is one of the leading causes of blindness in diabetic patients. Controlling blood sugar and reducing inflammation can prevent up to 95% of vision loss. What's next? Now that you understand how inflammation leads to vision loss, let's dive into the warning signs you should never ignore. Even if your vision seems fine now, the damage may already be happening inside your eyes. Stay tuned for the next section. Section 2. Early signs and symptoms. What to watch for. Silent, but deadly. The hidden warning signs of diabetic retinopathy inflammation. Diabetic retinopathy starts silently, meaning you might not notice any symptoms until the damage has already begun. But if you pay close attention, your eyes will give you warning signs. The earlier you recognize these subtle red flags, the better your chances of slowing down or even stopping vision loss. Let's break down the most common early symptoms and why they happen. Symptom 1. Blurry vision, even with glasses. What it feels like, vision becomes slightly hazy or unclear. You might struggle to read small print or see details. Worsens at night or after long periods of screen time. Why it happens? Fluid leaks from weakened blood vessels, causing swelling in the macula, the part of the retina responsible for sharp vision. High blood sugar causes the lens of the eye to swell, making vision unstable. Warning: if blurry vision comes and goes, it could be an early sign of retinal swelling. Symptom 2. Floaters. Dark spots moving in your vision. What it feels like. Small, dark specks or cobweb-like shapes that drift across your field of vision. You might try to blink them away, but they stay. Why it happens? Tiny blood vessels in the retina rupture and bleed, leaving behind small blood clots. The leaked blood casts shadows inside the eye, creating floaters. Danger sign: if floaters suddenly increase, it may indicate a large hemorrhage. Seek immediate medical attention. Symptom 3. Sudden flashes of light. What it feels like. Brief bursts of light in the corners of your vision. Happens even when your eyes are closed. Feels like a camera flash going off unexpectedly. Why it happens? Retinal inflammation and scar tissue pull on the retina, triggering these flashes. A warning sign of possible retinal detachment, which can lead to permanent blindness. Medical emergency. If flashes don't stop or are accompanied by floaters, see an eye doctor immediately. Symptom 4. Difficulty seeing at night, night blindness. What it feels like. Struggling to see in dim lighting or while driving at night. Headlights, streetlights, and neon signs appear extra bright or cause glare. Eyes take longer to adjust when moving from light to dark places. Why it happens? Blood vessel damage and low oxygen supply weaken the retina, making it harder for your eyes to adapt to darkness. Macular swelling, edema, reduces clarity in low light. Why it's dangerous? Night blindness can increase the risk of accidents and may indicate progressing retinopathy. Symptom 5. Colors look faded or washed out. What it feels like. Colors seem less vibrant or dull. Harder to tell different shades apart. Blue versus green. The world appears grayish or muted. Why it happens? Swelling and nerve damage in the retina affect the eye's ability to detect colors properly. Retinal cells responsible for color perception die off, leading to permanent changes. Warning: if colors appear distorted or faded suddenly, it could be a sign of macular damage. Symptom 6. Frequent headaches and eye pain. What it feels like. Persistent headaches, especially behind the eyes. Aching or pressure in the eyes worsens after reading or screen time. A feeling of eye strain or tiredness, even when well rested. Why it happens? Increased pressure from swelling inside the eye. Retinal blood vessel damage disrupts normal oxygen supply, leading to pain. When to worry? If headaches and eye pain occur daily, it could mean advanced inflammation or increased eye pressure. Symptom 7. Vision loss, the most serious sign. What it feels like. A dark spot or missing area in your vision. Parts of your vision become distorted, wavy, or completely black. Vision loss can happen suddenly or gradually. Why it happens? Severe bleeding in the eye blocks light from reaching the retina. Scar tissue and swelling cause permanent damage to retinal cells. Retinal detachment may occur, leading to irreversible blindness. Medical emergency. If you experience sudden vision loss, go to an eye doctor or emergency room immediately. What's next? Diabetic retinopathy inflammation is a time-sensitive condition. The earlier you catch these symptoms, the better your chances of saving your vision. Now that you know what to watch for, let's move on to the biggest risk factors that could put you in danger. Don't skip this section. It could mean the difference between clear vision and blindness. Section 3. Who is most at risk? Scene. A doctor checking a patient's blood sugar levels. Narrator. Are you at risk? Let's find out. You're at a higher risk if you have had diabetes for over 5 years, have uncontrolled blood sugar above 180 milligrams per deciliter frequently, have high blood pressure, hypertension speeds up eye damage, smoke or drink alcohol excessively, are over 50 years old, skip regular eye exams. Shocking stat. 60% of people with diabetes will develop some form of diabetic retinopathy in their lifetime. If you're in any of these high-risk categories, you need to act now. Section 4. How diabetic retinopathy progresses. 4 stages. Diabetic retinopathy gets worse over time. Here's how it progresses. Diabetic retinopathy doesn't happen overnight. It develops in 4 stages, each one more dangerous than the last. If left untreated, it can lead to total blindness. Understanding these stages is critical because early intervention can stop or slow the damage. Let's break down the 4 stages of diabetic retinopathy and how they affect your vision. Stage 1. Mild nonproliferative diabetic retinopathy, NPDR. The silent beginning. What's happening? Tiny blood vessels in the retina weaken, causing small bulges called microaneurysms. These bulges can leak fluid and blood, leading to mild retinal swelling. Symptoms. No noticeable vision loss yet. This is why many people don't know they have it. Occasional blurry vision or mild difficulty focusing. Risk. If blood sugar remains high, the damage worsens and moves to the next stage. What you can do. Tight blood sugar control can prevent further progression. Regular eye checkups are crucial. This is the best time to catch it early. Stage 2. Moderate nonproliferative diabetic retinopathy, NPDR. Damage increases. What's happening? The leakage of blood and fluid increases, causing more swelling in the retina. Oxygen supply to the retina is reduced, leading to cell damage. Macular edema, swelling of the macula, may start, affecting central vision. Symptoms. Blurry vision starts to become noticeable, especially when reading or focusing. Mild floaters, dark spots moving in vision due to tiny bleeding inside the eye. Struggles with night vision and contrast sensitivity. Risk. Without treatment, vision loss can start. Retinal swelling may cause permanent damage if ignored. What you can do. Lower blood sugar levels immediately. Consider medical treatment. Your eye doctor may recommend eye injections to slow swelling. Stage 3. Severe nonproliferative diabetic retinopathy, NPDR. Vision starts to deteriorate. What's happening? Blood vessel damage is now severe. Many vessels are completely blocked off. The retina is starving for oxygen, triggering dangerous growth signals. More bleeding and fluid leaks make vision blurrier. Symptoms. Significant blurry vision that doesn't go away. Dark areas, scotomas, appear in your vision. Increased floaters and flashes of light. Warning of retinal damage. Risk. Your retina is on the verge of growing abnormal blood vessels, which is the final, most dangerous stage. If left untreated, blindness is coming soon. What you can do. Medical intervention is crucial at this point. Laser treatments and anti-VEGF injections can slow disease progression. Stage 4. Proliferative diabetic retinopathy, PDR, the most severe and blinding stage. What's happening? The retina, desperate for oxygen, grows abnormal new blood vessels, neovascularization. These new blood vessels are weak and fragile, leading to massive bleeding inside the eye. Scar tissue forms, which can pull on the retina, causing retinal detachment. Symptoms: severe vision loss or complete blindness. Massive floaters and dark streaks in vision due to bleeding. Pain and pressure in the eye from increased internal bleeding. Total loss of central or peripheral vision. A medical emergency. Risk: high risk of permanent blindness. If the retina detaches, surgery is the only way to save vision. What you can do: emergency laser treatment or vitrectomy surgery is required. Immediate medical intervention can save some vision, but full recovery is rare. Section 5. How to reduce inflammation and protect your eyes. Stop eye damage before it's too late. Reduce inflammation now. Diabetic retinopathy is driven by chronic inflammation, high blood sugar, and oxidative stress. If you don't take control, it will worsen, leading to permanent vision loss. But here's the good news: you can fight back. Science has proven that targeted diet, lifestyle changes, and medical treatments can stop inflammation, slow disease progression, and even improve vision. Let's break down the best ways to reduce inflammation and protect your eyes, backed by science and used by top specialists. 1. Anti-inflammatory superfoods. Fuel your vision. What you eat directly impacts your eye health. The right foods can lower inflammation, improve circulation, and repair damaged blood vessels. Top 7 superfoods to fight inflammation in the eyes. 1. Leafy greens, spinach, kale, collard greens, rich in lutein and zeaxanthin, antioxidants that protect your retina. Reduces oxidative stress and inflammation in the eyes. Berries, blueberries, blackberries, raspberries, packed with anthocyanins, which strengthen blood vessels and improve circulation. Lowers oxidative stress and slows retinopathy progression. Avocados loaded with healthy fats and vitamin E reduces oxidative stress. Boosts absorption of eye-protecting antioxidants. 4. Fatty fish, salmon, mackerel, sardines, high in omega-3 fatty acids, which fight inflammation and improve eye circulation. Reduces macular edema and protects against blood vessel damage. Citrus fruits, oranges, lemons, grapefruit. Vitamin C strengthens eye capillaries and slows retinopathy. Powerful antioxidant effect protects against free radical damage. Nuts and seeds, walnuts, chia seeds, flax seeds, rich in omega-3s and vitamin E, essential for reducing inflammation. Improves nerve function in the eyes and reduces blood vessel leakage. Garlic and onions, natural blood thinners, help prevent eye pressure buildup, reduce inflammation, and support healthy blood sugar levels. Eye health diet tip: cut down on refined carbs and processed foods. They spike inflammation. Drink green tea and turmeric tea. Both are powerful anti-inflammatory drinks. 2. Lifestyle changes. Daily habits that save your vision. If you want to protect your eyes, your daily routine must support healthy blood vessels. 1. Get moving. Daily exercise for eye health improves blood flow to the retina and reduces swelling. Lowers blood sugar naturally, reducing inflammation. Best exercises: walking, yoga, swimming, cycling. Sleep like your vision depends on it, because it does. Poor sleep increases inflammation and blood sugar spikes. Aim for 7 to 9 hours of high-quality sleep to allow eye repair. Protect your eyes from blue light and UV damage. Wear sunglasses outdoors to prevent UV-related eye stress. Use blue light filters on screens to reduce retinal inflammation. 3. powerful supplements for eye health and inflammation control. These natural supplements have been shown to protect the eyes and reduce inflammation. 1. Omega-3 fatty acids from fish oil or algae oil reduces macular swelling and improves blood circulation in the retina. Lowers inflammatory markers linked to retinopathy. Curcumin from turmeric plus black pepper blocks inflammatory pathways that damage blood vessels. Boosts antioxidant defenses in the eyes. Alpha-lipoic acid, ALA, enhances insulin sensitivity, reduces blood sugar spikes, protects nerves and reduces oxidative stress in the retina. Lutein and zeaxanthin filters harmful blue light and prevents retinal damage, slows disease progression and improves contrast sensitivity. Res. 4. Best medical treatments for diabetic retinopathy inflammation. If diabetic retinopathy is progressing, medical treatments can stop the damage and save your vision. 1. Anti-VEGF injections. Eylea, Lucentis, Avastin, blocks abnormal blood vessel growth in the retina, reduces swelling and leakage, improving vision. 2. Laser therapy, photocoagulation, seals leaking blood vessels and prevents further damage. Best for preventing blindness in advanced cases. Steroid injections for macular edema reduces inflammation in the macula, central part of vision, helps restore clarity and reduce swelling. Vitrectomy surgery, for severe cases, removes blood from inside the eye if there's severe bleeding, prevents retinal detachment and vision loss. Section 6. Treatments. What to do if you already have it. If diabetic retinopathy inflammation is already affecting your vision, don't panic. Here are the best medical treatments available. Anti-VEGF injections stops abnormal blood vessel growth and reduces swelling. Laser therapy, photocoagulation, helps seal leaky blood vessels. Vitrectomy surgery removes severe bleeding in advanced cases. Important: the sooner you start treatment, the better your chances of saving your vision. Conclusion. The final takeaway: diabetic retinopathy inflammation is preventable, but only if you take action now. Let's recap. Early detection is key. Get regular eye exams. Control your blood sugar and follow an anti-inflammatory diet. If symptoms appear, see a doctor immediately. Your vision is priceless. Don't wait until it's too late. Question of the day: have you or someone you know experienced vision problems due to diabetes? Drop a comment below and share your story. Like, share and subscribe for more